Brian is here to talk about Guillain-Barré Syndrome.
Guillain-Barré Syndrome is a rare and serious condition of the peripheral nervous system. It occurs when the body's immune system attacks part of the nervous system. The exact cause of Guillain-Barré syndrome is unknown. However, around 60% develop the condition shortly after having a viral or bacterial infection. It is thought infection may trigger the immune system to attack nerve roots and peripheral nerves. The symptoms of Guillain-Barré syndrome usually develop 1 to 3 weeks after a minor infection, such as a cold, sore throat or gastroenteritis. The symptoms of Guillain-Barré syndrome can develop quickly over a few hours. The muscle weakness often gets progressively worse within a few days. Symptoms often start in your feet and hands before spreading to your arms and then your legs. Initially, you may have pain, tingling and numbness, progressive muscle weakness, coordination problems and unsteadiness. You may be unable to walk unaided. The weakness usually affects both sides of your body and may get worse over a period of several days. In mild cases of Guillain-Barré syndrome, your muscles may only be slightly weakened. In more severe cases, the muscle weakness can progress to temporary paralysis of the legs, arms, and face, temporary paralysis of the respiratory muscles, difficulty with eye movement, difficulty speaking, blurred or doubled vision, difficulty chewing or swallowing, resulting in the need to be fed through a tube, difficulty with digestion or bladder control, fluctuations in heart rate or blood pressure. Some people with Guillain-Barré syndrome do not experience any pain, while others have severe pain in their spine, arms, and legs. See your GP if you notice any of the above symptoms. However, seek immediate medical assistance if you experience any of the following symptoms: difficulty breathing, difficulty swallowing, lightheadedness when standing, fainting. There is no cure for Guillain-Barré syndrome, but there are a number of treatments that can reduce your symptoms and help recovery. Click the link in the description for more. You will be treated in hospital, where you will have a number of tests. Your condition will be closely monitored, including your breathing. Depending on the severity of your condition, you may be admitted to a general ward, a neurology ward, an intensive care unit, a high dependency unit. If you are having difficulty breathing, you may be put on a ventilator. Around a quarter of people with Guillain-Barré syndrome need to use a ventilator. 8 out of 10 with Guillain-Barré syndrome make a full recovery. It usually takes several weeks to recover after the start of symptoms. However, some people will need to spend longer in hospital or a neurological rehabilitation unit. While some people recover quickly, it can take a year or more before a full recovery is made. It is estimated that 1 or 2 people in every 10 will not recover completely from Guillain-Barré syndrome. Possible long-term complications include being unable to walk unaided, loss of sensation and coordination, loss of balance, muscle weakness in your arms and legs. Problems with your sense of touch known as dysesthesia, which may be felt as a burning or tingling sensation, persistent fatigue. There is a 1 in 20 chance of dying from Guillain-Barré syndrome. This is usually the result of complications that develop during the first few weeks of the condition. For example, respiratory failure, where your lungs are unable to provide enough oxygen, infections, heart rhythm disorders including cardiac arrest, bowel obstruction.
Thanks, Brian.